In this morning's Health Watch, organ donations and Facebook. 500 million people use Facebook to connect with their friends, lovers, exes, colleagues. Now, though, it is literally saving lives by linking potential organ donors with the patients who need those organs. CBS News correspondent Michelle Miller has the story of one perfect match.
Just April, actually.
As the youngest mayor of East Haven, Connecticut, April Capone knows the importance of pressing the flesh.
It's very nice to meet you. Do you want her in the ceremony?
Thanks to a post that hit her Facebook page in late 2009, she's taken it one step further.
It was like a little SOS. I need help.
It came from one of her constituents, Carlos Sanchez. In the throes of renal failure after his first transplant failed, Sanchez faced another lengthy wait for a healthy organ. With no relatives who were a match, his doctor suggested he turn to his Facebook family.
Sounds good. All of a sudden, I get that private text, and I didn't pay no mind. I didn't answer her. I said, I think she made a mistake. I think she meant to say, you'll be my thoughts and prayers.
A few hours later, a second message came through.
Carlos, I'll get tested. I've got 2, so what the hell? You can have 1.
I thought, what are the odds of her being a match to me?
Turns out she was. And in April of 2010, doctors removed April's left kidney and gave it to Carlos. Facebook tells CBS News that it doesn't track or police these types of posts, but it has noticed what appears to be an increase in the number of users soliciting kidney donations on its website. The official organ donor list, regulated and funded by the federal government, has a typical wait time of 3 to 5 years. And all of those donations come from the deceased.
Right now, we have no organized system concerning live organ donation.
That has spawned websites that match potential live donors with recipients. Like Facebook, they're not subject to federal oversight. And while bioethicist Dr. Robert Klitzman acknowledges that these sites do help save lives, he favors a more formalized protocol to reduce foul play, like paying for organs.
What we need is a coordinated system to ensure that as many people can get organs from as many people who are willing to give as possible.
If it wasn't for Facebook, I wouldn't have had this transplant.
A year later, Sanchez's health restored.
Your transplant kidney is doing quite excellently.
They share more than a pound of flesh.
Carlos wasn't my brother, but he is now.
They share each other's lives.
She's my angel. Because of her, I'm able to see my son. My son graduates this year.
Michelle Miller, CBS News, East Haven, Connecticut.
What a story. Joining us now, medical correspondent Dr. Jennifer Ashton. Jen, this is amazing. We saw in the piece that the doctor actually encouraged Carlos to reach out on Facebook. But how common is this?
Well, I think it's becoming more common, Erica. Carlos, in this piece, had already had a kidney transplant. That one had failed. He was about to need to be relisted on the list. And the average waiting list for a kidney is 3.5 years. Overall, in this country, over 110,000 people are on the transplant list waiting for any type of organ. So I think in those situations, really you need to do, certainly to reach out for other resources like this, and it will be becoming more common.
It's a wonderful, incredibly selfless gesture. Right. We should point out that this doesn't, to be a donor, I should say, but it doesn't come without risks.
Exactly, and there is actually no long-term data on the risks or complications of living organ donation, either from a physical or a psychosocial standpoint. But when you talk about the immediate short-term risks, this is major surgery. So you can have severe bleeding, you can have infection. When you talk about a kidney donor, you're talking about the possibility of high blood pressure in the future. And then when you talk about the psychosocial or emotional risks or complications to the donor, you obviously want to make sure there's no coercion involved, and obviously it is illegal to pay to buy or sell an organ.
Which is really important. And we're talking about kidneys here, but are there other organs which could work in terms of a living donor?
Well, in terms of a living donor, there are a couple of other ones. You know, we're hearing more and more about liver, donating part of your liver, part of the lung, part of the pancreas, or part of the intestines. Not as common as whole solid organ transplantation, but becoming more so.
You actually worked, as I understand it, with 6 months you spent with a heart transplant unit, which just gives you incredible experience in this department. When you look at this, though, what are some other things that people should take into account before heading down this path to help someone?
Well, I was on the heart transplant donor team, so so I actually got a first-hand look at what's involved from the donor's standpoint. And I think what most people don't realize, when you're talking about a deceased organ donor, that person is brain dead. They're still technically alive, but brain dead. And most of the time, the relatives are the ones who make that decision to donate organs. So this is actually something that you want to talk to your friends and family about and let them know your wishes. When you talk about the opportunity of taking a tragedy or a sorrowful experience and making it into a positive one, solid organs can save 8 to 9 lives per organ donor. Wow. And when you talk about donating soft tissue and organs, up to 50 lives can be saved. It's incredible.
Really puts it in perspective. Jen, thanks.
You bet.